We are currently in a frenzy of activity from the standpoint of diagnosis and treatment of uterine fibroids. Of course, fibroids are a very, very common entity in the female population, occurring in probably 30 to 40% of women. Most of these fibroids, fortunately, are not symptomatic, they don't really need to be treated. However, in those patients who do require treatment, we are currently looking at some new technologies to help ourselves with the treatment of these fibroids. You can divide women with fibroids into two separate entities. One is patients who have asymptomatic fibroids and really don't need to have anything done with their fibroids. Then you have a group of patients who either have pain, pressure, or more commonly bleeding that precipitates the need for them to seek help with their fibroids. Those people with fibroids who need help can look at several different entities. We have medical therapies that can, in fact, shrink the fibroids and do some good in that regard. However, most of those are what we would consider temporizing treatments. That means that they'll work while the patient is taking those medications, etc. But after the patient gets off the medicine, the fibroids will return to the size that they were before the medicine was started. And sometimes they're not effective also. And to some degree, some of those medications might be not tolerable for the patient. In other words, they won't feel well enough on the medicines for them to use them. Other types of therapy include surgical forms of therapy where fibroids can be removed. From an exciting standpoint, these fibroids, even quite large fibroids, can be removed laparoscopically using minimally invasive techniques, where the patient can come and have a fibroid removed and go home the same day and be back doing what she normally does, really over a matter of just a couple of days. In addition, if hysterectomy is indicated, that also can be done in a minimally invasive manner. Okay, so again, we've got a lot of options in that regard. The two newest options, one that's been around for probably a decade or more, is called uterine artery embolization. And again, that's a very specific group of patients who probably those are patients who have bleeding problems, not the very large fibroids. That's probably not the world's best people for that. And then we have a brand new technology called MRI-focused ultrasound, which is exciting because uniquely patients who have MRI-focused ultrasound, and these are patients predominantly with larger fibroids who have bulk symptomology. They have pressure and they pain, etc. in that regard. Sometimes bleeding, but more often pain or pressure. And those patients can have MRI-focused ultrasound performed. However, in addition, those patients can be patients who are potentially seeking pregnancy after that. And the uterine artery embolization, really, those patients probably are not patients who want to try to have babies afterwards. It's just not the right thing to do. I think that's been demonstrated both in the United States and in Europe. And so we're excited to have a non-invasive method that is this MRI-focused ultrasound, who we can in fact decrease some of these bulk symptoms, and these are patients who, if they desire to become pregnant later, can do so. So we've got really have a lot of things for women to think about and learn about. Importantly, because the screening process for things like MRI-focused ultrasound is a very important component. Women need to know about this entity, and they need to know that it's available and get into the process of screening for the MRI-focused ultrasound. Because again, there are some things that make that procedure not the right procedure for a specific patient. So Again, it's an exciting time. I think it's a very good time from the standpoint of women's health, in that we do have a number of different options and alternatives for women with this very, very common disorder of uterine fibroids.